I'm Dr. Sandra Laura Cremers, and I wanted to talk about the options for dry eyes. If you're having any pain, burning, redness, reflex tearing, foreign body sensation, I want you to listen to the video so we can help you get better faster. So we now know dry eyes is a very complex issue, which involves 3 layers of the tear. So there is the aqueous layer that comes from the lacrimal gland, the mucin layer that comes from goblet cells around the cornea, and the meibomian gland layer that produces a fatty substance of oil. And that meibomian gland prevents the tear from evaporating. One of the things we will do on patients with dry eye complaints is do meibography, which is called a liposcan or lipiview. And we're looking at the glands to make sure they look normal. These are look like piano keys, very thin lines filled with oil. And we have about 30 to 40. They should look like this. If somebody comes in with this, where the glands have disappeared, we know it's going to be harder to treat them and get rid of their symptoms. So we try to get to patients early on when they have a little bit of gland loss, but not severe. So we'll scale this and grade it on a scale of 0 to 3, 3 being the worst in terms of loss of glands. So how can you save your glands? Well, there's some basic things that you've seen on some of my other videos on YouTube and in the office on how to prevent the glands from disappearing. The most important thing is blinking every day. The normal blinking rate is about 20 to 30 times a minute, but we know that 40 to 50 is probably better. So we want you to wash your face every day, 2 or 3 times a day. Ideally a warm compress for ideally 15 minutes at a time is what the studies say will help, but even 5 minutes at a time will help. So we want you to do the warm compresses, blinking frequently, doing the massaging of your eyelids to get the oil pumping out. Just like if you have a cow and you don't milk the cow dries up, and the same thing with these glands. If somebody's staring at the computer for hours at a time, we will see those glands disappear. And so the first step on this very busy piece of paper I give to patients, these are all the treatments in the world that we have for dry eyes, and they still really are all the treatments, but we start with the least invasive, least difficult first, and the easiest one to do is the warm compress routine. So I encourage patients to read step 1, which is basically the cleaning, warm compresses, and then cleaning their eyelids with either diluted tea tree oil or a product called Avenova. Tea tree oil is very inexpensive. It's about $35 for a bottle at CVS over the counter, but it can burn if you get it in the eye or if you're sensitive to the tea tree oil. Avenova doesn't burn. It's a prescription spray, and you don't have to even wash it off, so that works very well. And then there's a company that developed this OxySoft Hypochlor that also works well. Some people don't like this. They prefer the Avenova. Different skin types prefer different products, so the only way to know how you will respond is by giving it a try. I've had some people try Clearadex or tea tree oil in one eye and then try Avenova in the other eye and see which they prefer. I personally will use both tea tree oil and Avenova from time to time. Avenova is very easy to use when you're at a stoplight. You just spray it on the eyelids of the car, but the tea tree oil I use at home. And then we'll sometimes give an ointment at nighttime, which is after you do the warm compress, right before you go to bed, you put a little bit of the ointment on your finger, rub it into your eyelashes, go to bed, and in the morning you wash it off. That does 2 things. It kills any bacteria in the eyelashes, and it forces you to wash it off in the morning, which is very important as well. The ointment suffocates mites and bacteria. Some people will use coconut oil sometimes. Some people feel these ointments clog their glands. We don't have proof of that, but you find what works in terms of preventing any type of styes or any type of gritty sensation, which is almost always due to mites, bacteria, and a combination of dead cells that we shed every day. So that works very well. The second step is omega-3, and different people take different amounts, but studies have shown 2,000 to 4,000 milligrams of omega-3 a day will help produce more oil in the glands, and you can get it in various ways, over the counter, pills. I prefer wild salmon frequently, herring, walnuts. There's all kinds of ways to get it. My blog, 2020idoc at blogspot.com, goes through the best omega-3 type foods. There's examples of TheraTears. The best pill proven with drug company money by the company is PRN, and that's on my list here. So that's a company that published the best study that we have on omega-3, but it was sponsored by that drug company. So that's one of the only papers we have showing that medical grade omega-3 really works, but it was sponsored by that company. So we recommend that, and I recommend patients just read through number 2 to see about trying a gluten-free diet or low inflammatory diet to help with any other symptoms they may have. And some people swear that helps, but we don't have randomized controlled studies to say that helps yet. Third step is artificial tears. There's thousands of tears. We know that non-preserved tears are the best. They're a little bit more expensive, harder to use, but you can use them every hour. If it has a preservative, the artificial tear should only be used at most 4 times a day. And the best artificial tear without drug company money, studied at Harvard, is still Retain, and that's a non-preserved tear you can get on Amazon, and that looks like this. And they come in these little tubes here that we usually will have people put it in a plastic Ziploc bag so you can use what's in there until it runs out. Just don't contaminate the tip. Otherwise, there's artificial tears with preservatives like Refresh. You'll see gel drops are thicker so they can blur the vision more. There's one that they're not gel that don't blur the vision but don't last as long. So that's a preservative artificial tear. And then there's some new treatments like Xiidra. The drug company is actually giving away free samples of this new drug. It is FDA approved. It is non-steroidal. It has no steroids. The biggest risk with this drop is it doesn't work. I've seen one case of an allergic conjunctivitis. Some people don't like the taste, so they'll do punctal occlusion, where you close your eye and put pressure in the corner so the canal that goes between the eye and the nose is closed, so the drop doesn't go into the throat because it can taste a little bad for some people. And we have you put it in the refrigerator because it does burn when it goes in. It takes only 2 weeks to work, as opposed to Restasis, which is also a non-steroidal, which we've used for many, many years. Restasis takes 3 months to really kick in. And the point of Xiidra and Restasis is to decrease scar tissue formation on your eye, which is crucial to preventing long-term chronic pain from dry eye. And so you can see, this is the Xiidra. It's also non-preserved, so it comes in these little packages. And just like the one I showed you, these individual vials there. And then the multi-dose Restasis has just come out. So I think it's a little bit easier for patients to use because they can reuse it in terms of closing the top, that is. So it looks like this. That's how that looks. They still have the small individual Restasis ones like this, but they're gonna get rid of those soon. So let us know if you prefer these. But these, again, we put in a Ziploc bag until we use them so they don't get self-contaminated. So those are the new drops for dry eyes. And if somebody is not helped with that, we will then sometimes start Doxycycline, which is a pill by mouth, which is an anti-inflammatory, not an antibiotic, at that low dose. And then sometimes we will do punctal plugs, which is a cover over the drain that keeps the tear in the eye longer. And if someone has no time for any of this, we jump to Lipiflow, which is a wonderful FDA-approved instrument that we put on the eyelids, just like this. It's an apparatus that goes basically around the eyelids. It just protects the cornea, and it provides heat and compression to milk the glands. And so we recommend that once a year if you don't have time to do the warm compresses, but I have some patients come in for twice a year if they really don't do any warm compresses. And the point of Lipiflow is to prevent you from losing more glands. So we have FDA proven studies that about 97% of patients will not lose their glands if they have the Lipiflow once a year. One study from Harvard showed you have an effect with Lipiflow up to 3 years after one Lipiflow treatment, which takes about 12 minutes and there's no pain, especially if you do the warm compresses every day. So the ideal is warm compresses every day, morning and night at least, and Lipiflow once a year, but some people can do it once every 2 to 3 years if they do the warm compresses. And then the other options are more expensive in terms of intense pulse light and probing, and they're very uncomfortable, but some people really benefit from that. So the rest of the step ladder I'll go through in another video, but I wanted to give you this first one so you have an idea of where we'll be heading with your treatment. Let me know if you have any questions.